Hi there. I thought today we would play a game of Name That Diagnosis. I'm Dr. Meagan von Holtz, and I was realizing about 2 weeks ago that I had some of the symptoms that my patients commonly have and don't usually come up with what it is. So I thought it would be fun for me to list the symptoms and for you to try to guess what it is. So about 2 weeks ago I had a dull headache for about 3 days. Now, like many of you, honest, I didn't pay much attention to it. You know, there was a lot of stuff going on around here. I didn't have time to grab one of the providers to get my neck adjusted, so I just dealt with it. But then after 2 days, I started to feel like a funny, full, itchy feeling in my ear, and I thought, okay, that's weird, and I just kept going. But on the third day, I kept catching the left side of my front tooth on my bottom teeth, and to me, that's like, you know, fingers on a chalkboard, and I thought, okay, let me think about this. Dull headache, full itchy feeling in my ear, and now it's almost like I have an overbite. What is this? Can anybody think, what is that diagnosis? It's actually Temporomandibular Joint Dysfunction, or we call it TMJD for short. I see it actually a lot of times in patients, but a lot of times it goes unnoticed because it comes with other symptoms a lot of times. Sometimes people will have terrible headaches or neck pain, you know, that's what we're treating. Sometimes a jaw problem can be direct, like if you're in a car accident or someone hauls off and punches me in the jaw, then okay, yes, we're going to have a direct TMJ disorder. But a lot of the times it comes associated with other things. If you think about it, you've got these upper bones in your neck, the jaw, and then the eustachian tube in your ear on each side, and if you put them together, it's almost like they form a ring. And if one of those things is off, either the upper bones in your neck, the jaw, or something about your ears, a lot of times you can get symptoms along those three areas put together. The other thing with jaw is most of the time it isn't those direct traumas, it's repetitive little things over time, like poor posture in the neck, shoulders, or even the jaw. There's actually articles in dental journals that talk about an overbite actually being associated with neck pain and dysfunction in the jaw. There's definitely things that we can do in the office to treat it. Things that we're looking for other symptoms too, like sometimes you'll get a clicking or a popping. Sometimes people have trouble opening their mouth all the way. You really should be able to put 2 to 3 fingers like this in your mouth and get it to open that far. A lot of people can't do that because of pressure here. So lots of different symptoms all leading to the same diagnosis, but the treatment is different too depending on, as usual, what does it come from. So next week we'll talk a little bit about things that it comes from, and then ways that we can treat it. You have a great day. This is Dr. Meagan von Holtz with the topic of the week.